Welcome to the Deep Dive. This is where we take stacks of research, papers, data, and really boil it down for you, giving you the core insights, kind of a shortcut to being genuinely well-informed.
That's the goal.
And today, we're tackling something. Well, it challenges a very common idea, doesn't it? That if you just spend more money on health, you get better health. Simple as that.
Right. Seems intuitive.
But as you're about to hear, especially when we look at developing and emerging economies, the picture is, it's way more complicated and actually pretty fascinating.
Absolutely. The study we're digging into today really highlights that complexity. It's by Tiken called How Do Economic, Environmental, Social, and Health Factors Affect Health Outcomes? And it's looking at 21 developing and emerging economies.
Okay, so quite a broad scope. Which countries are we talking about roughly?
It covers a lot of ground: South Asia, Southeast Asia, the BRICS nations, Brazil, Russia, India, China, South Africa, and the ASEAN bloc as well. And it's looking at data over 20 years, from 2000 to 2019.
20 years. That's substantial. And what are the key health measures they're tracking?
They focus on three big ones: Crude Death Rate, or CDR, Infant Mortality Rate, IMR, and Life Expectancy at Birth, LB. Pretty standard but crucial indicators.
Got it. So you said challenges, assumptions. What was the big, maybe surprising finding right out of the gate?
The really striking thing is that the study found no consistent relationship between things like health spending, the actual health outcomes we just mentioned, and a country's wealth, measured by GDP per capita.
No consistent link between spending more and getting healthier.
Not a straightforward one, no. It really underlines how much non-economic factors matter. Things beyond just the healthcare budget seem to play a huge, sometimes even bigger role in how healthy a population actually is.
Wow, okay. It's definitely not the simple story we often hear. So how did the researchers manage to, untangle all these different threads? It sounds incredibly complex.
It is, and they needed some specific tools. They actually developed two unique measures for this study. One is the Health Input Augmenting Index, HIAI. Think of that as tracking all the things that should contribute to good health, like spending, infrastructure, maybe staffing.
Okay, the inputs.
Right. And the other is the Health Outcome Incidence Index, HOAI. That measures the actual health status, looking at those death rates, infant mortality, life expectancy figures.
So inputs versus outcomes. HIAI and HOAI.
Exactly. And using these two indices allowed them to see patterns that weren't obvious before, especially, like you hinted, when they started comparing different regions.
And this is where it gets really juicy, right? The comparison between, say, the ASEAN countries and the BRICS nations.
Okay.
Let's start with health spending as a slice of the economy, percent of GDP. How did that play out differently?
Well, in the ASEAN countries, it was sort of what you'd expect. More health spending as a percentage of GDP was linked to better outcomes, lower crude death rate, lower infant mortality.
Okay, that fits the standard model.
Yeah.
More investment, fewer deaths. Makes sense.
It does. But then you look at the BRICS nations.
Let me guess, it's different.
Completely the opposite, actually. In BRICS, higher health expenditure as a percentage of GDP was associated with worse effects on CDR, IMR, and even life expectancy.
Worse. Spending more was linked to worse health.
Yeah.
How? How can that be?
It's a critical finding and deeply counterintuitive. The study suggests a few possibilities. Maybe it's about inefficient spending. The money isn't going where it's most needed. Or perhaps there's too much focus on expensive, high-tech curative treatments rather than basic preventative care that helps more people.
Or maybe governance issues. Money getting lost in the system.
That's definitely another potential factor the study mentions. Things like lack of transparency or accountability. It means just throwing money at the problem isn't enough if the system itself isn't working efficiently.
That really underscores it's not just how much you spend, but how you spend it. What about other money factors, like people paying out of their own pockets? That's a huge issue in many places. Did that show similar regional contrasts?
It did, and again, with some surprises. In ASEAN, when out-of-pocket costs went up, health outcomes generally got worse.
That makes sense, too. If people can't afford care, they don't get it, or wait too long.
Precisely. It limits access, especially for the poor.
Okay, but given the last finding, I'm bracing for the BRICS twist here.
Yeah.
What happened with out-of-pocket costs in those countries?
You guessed it. Another twist. In the BRICS countries, and actually looking across all the countries in the study overall, higher out-of-pocket spending was linked to a reduction in the crude death rate.
A reduction? Paying more out of pocket was linked to fewer deaths. That seems completely backwards.
It's a real head-scratcher, isn't it? The study theorizes a bit. Perhaps it points to situations where the public system is so under-resourced that paying directly is the only way to access certain life-saving treatments. Or maybe it shows that private care is filling critical gaps left by the public system for even basic services.
So it's not necessarily a good sign, but it reflects a reality where direct payment might bypass bottlenecks in a struggling public system.
Potentially, yes. It highlights a complex, maybe even dysfunctional access reality rather than saying out-of-pocket payments are inherently beneficial. It's really nuanced.
Man, this really does flip conventional wisdom on its head. So, okay, health spending is complex, out-of-pocket costs are complex. What about just general economic prosperity? GDP per capita. Surely richer countries are healthier countries. Was that link straightforward?
Again, not universally. In the BRICS nations, higher GDP per capita actually seemed to have a negative impact on crude death rate, infant mortality, and life expectancy.
Negative. Being richer was linked to worse health outcomes in BRICS.
According to this data analysis, yes, it directly contradicts that simple wealth equals health idea. Perhaps it's tied to inequality. Maybe the economic growth isn't translating into better public health infrastructure or services that benefit everyone. Or maybe growth comes with other problems, like pollution that offset health gains.
Fascinating. But what about ASEAN? Did higher income work as expected there?
In ASEAN, yes, it was more aligned with typical assumptions.
Yeah.
Rising incomes were linked to lower infant mortality rates.
So the impact of economic growth itself seems to vary significantly by region. You really can't just apply one rule globally.
Absolutely not. That's one of the clearest messages. Context matters immensely.
Okay, this is definitely a deep dive. So if the money side directs spending, GDP isn't the main driver, or at least not consistently. What else did the study find really moves the needle? You mentioned non-health factors earlier.
Yes, and this is crucial. The study found that the impact, or the elasticity as economists call it, of these non-health factors was often stronger than the impact of direct health inputs like spending.
Stronger. So things outside the hospital walls matter more? Like what?
Exactly. Take environmental factors, specifically carbon dioxide emissions in this study. Higher CO2 emissions were pretty consistently linked with worse health outcomes across all the country groups they looked at: BRICS, ASEAN, the whole set.
That makes intuitive sense.
Yeah.
Air quality, climate effects, they obviously impact health directly.
Right. It connects public health to much broader environmental policy, which sometimes gets overlooked in purely health-focused discussions.
What about demographic things, like more people living in cities? Urbanization, good or bad for health overall?
It's a bit mixed, but generally positive in this analysis. The study found that a larger urban population tended to reduce crude death rate and infant mortality and improve life expectancy, especially in the overall data set and in ASEAN.
But potentially with downsides too, depending on how cities manage things like sanitation or overcrowding.
Presumably, yes. The study flags it as generally positive, but acknowledges nuances depending on how urbanization unfolds in specific contexts.
Okay, and here's one that really jumped out at me from the notes. An aging population, more people over 65, was linked to a reduction in infant mortality.
Wow.
That feels backwards.
It does seem counterintuitive at first glance, but yeah, an increase in the share of the population aged 65 and older was associated with lower infant mortality rates.
How? What's the thinking there?
Well, it might reflect broader societal improvements. If a society is getting healthier overall, allowing people to live longer, maybe that same society is also better at ensuring infant survival. Perhaps better elder care frees up resources, or it indicates better social safety nets generally. It suggests a kind of overall positive development trajectory.
Huh. So it's less about the old people directly causing fewer infant deaths and more a sign of a generally improving system.
That seems to be the most plausible interpretation, yeah. It's an indicator of wider progress.
Okay, so we have all these complex factors, economic, environmental, social, interacting in surprising ways. How did the study try to visualize this? I understand they grouped countries into clusters based on their inputs and outcomes.
That's right. They mapped countries based on their HIAI score, the health inputs against their HIAI score, the health outcomes, and two main clusters emerged.
Let's hear about them. What was the first one?
The first one is really interesting. They sort of call it the puzzle cluster. These are countries that have decent, sometimes even good health inputs according to the HIAI index, but they still have poor health outcomes, a bad HOAI score.
Inputs are okay, but results are bad. Any examples?
South Africa is the prime example highlighted. It had the highest HOAI score in the study, meaning, on paper, strong inputs. But it had the absolute worst HOAI score, terrible health outcomes.
Highest inputs, worst outcomes. Wow, that really points to a major problem with translating resources into results, doesn't it?
Exactly. It screams inefficiency or mismanagement or perhaps deep structural problems that resources alone can't fix. Russia was another example. High inputs, but also a high crude death rate. Or you had countries like China and Vietnam, which had relatively poorer input scores but managed average or even better outcome scores. So the link was broken in different ways.
Okay, that's the puzzle cluster. What was the other group? The expected cluster.
Yes, the expected cluster behaved more like you'd, well, expect. Countries with better inputs tended to have better outcomes, and those with poor inputs tended to have poor outcomes.
So a clearer link there.
A much clearer link. Singapore was a good example, strong on both inputs, HI, and outcomes, HU, plus a high GDP. The Maldives and Malaysia also stood out, showing good performance even with lower GDPs, suggesting they might be using their resources quite efficiently.
And on the other end of that cluster.
You also had countries with poor inputs and, sadly but predictably, poor outcomes. Pakistan, India, Myanmar, Bangladesh fell into this category in the study's analysis.
So while many countries fit the expected pattern, that puzzle cluster really drives home the point that just pouring in resources isn't a magic bullet.
Precisely. It's not just about having the money or the facilities on paper. It's about the entire system working effectively to deliver actual health improvements for the population. Governance, efficiency, equity, they all matter hugely.
Okay, let's bring this home. What does all this mean for, for us trying to understand global health, and maybe more importantly, for policymakers trying to actually improve it? It sounds like the old playbook might need revising.
It definitely suggests the need for a more nuanced approach. For policymakers, the first big takeaway is that, yes, increasing public health spending is often necessary, but it's absolutely not sufficient. It has to go hand in hand with serious efforts to improve efficiency, ensure good governance, transparency, accountability. It's the how, not just the how much.
Right. Don't just sign the check. Make sure it's actually buying better health.
Yeah.
And what about those tricky out-of-pocket payments? Given the weird results, what's the policy angle there?
Well, despite the odd finding in BRICS, the general picture, especially in ASEAN, suggests high out-of-pocket costs are detrimental. So efforts to reduce that burden are still crucial. Things like state-sponsored health insurance schemes or strengthening public provision can help make sure people aren't bankrupted by getting sick or don't avoid seeking care because of cost.
Makes sense. Protect people from catastrophic costs. And finally, based on everything we've discussed about non-health factors, what's the message there?
It's perhaps the most critical message. We need to think much more broadly about health policy. You simply have to pay more attention to these non-health determinants.
Like the environment.
Exactly. Reducing CO2 emissions isn't just climate policy. It is health policy based on this data. Addressing income inequality where it's linked to poor outcomes. Improving urban planning and infrastructure to support health. These factors have such a strong influence they can't be ignored. Health isn't created just in clinics, it's created in communities, in the environment, through economic policy.
It requires a much more joined-up, intersectoral approach, really, breaking down those policy silos.
That's absolutely the implication. Health needs to be a consideration across many areas of government and society, not just the Ministry of Health.
Okay, so just to recap this fascinating dive. Health outcomes are this complex blend of economic, environmental, social factors, plus direct health inputs. The connections aren't simple or linear. Non-health factors often pack a bigger punch than we realize, and the dynamics can look really different in places like ASEAN versus BRICS.
That sums it up well. And it leaves us with a pretty provocative thought, I think.
Go on.
If we're serious about boosting health across the globe, maybe the biggest levers aren't just inside the healthcare system. This research really makes you ask, what are the fundamental changes we need in how we approach development itself, thinking beyond just GDP growth that could unlock the really big jumps in human well-being and health?
A powerful question to end on. We need to look beyond the hospital budget. Thanks for unpacking that complex study with us.
My pleasure. It's crucial work to understand.